Gonorrhea. What to know? Gonorrhea is a common sexually transmitted infection or STI. A person can transmit it during any kind of sexual contact. With an early diagnosis, effective treatment is usually available. However, without treatment, gonorrhea can result in long-term complications. Gonorrhea is usually easy to treat, but delaying treatment can result in serious and sometimes permanent complications. For example, pelvic inflammatory disease occurs in females when the gonorrhea infection affects the uterus or fallopian tubes, and this can lead to infertility. Possible complications in males with gonorrhea include epididymitis, which is inflammation of the tube that carries sperm. This problem too can result in infertility. Symptoms. Many people with gonorrhea do not notice any symptoms. Those who do experience symptoms may have a burning sensation during urination. Males may also notice a white, green or yellow discharge from the penis, pain or swelling in the testicles, inflammation or swelling of the foreskin. Females may also experience increased vaginal discharge and intermenstrual bleeding. Rectal symptoms may also occur if a person has anal sex. This may include discharge, itching around the anus, soreness, bleeding, pain during bowel movements. If gonorrhea results from anal sex, the person may have a throat infection, but they might not notice any symptoms. If infected semen or vaginal fluid enters the eyes, the person may develop conjunctivitis. Diagnosis. A person may go to the doctor due to experiencing symptoms or because they believe that they have had exposure to gonorrhea. The doctor will ask the person about their symptoms and their medical history. They will also carry out a test such as a urine sample or a swab of a potentially affected area, usually the penis, cervix, urethra, anus or throat. The individual can send a sample to a laboratory and they will receive the results directly. If the result is positive, however, the person will need to see a doctor for treatment, and the doctor may wish to do another test to confirm the result. Causes. The bacterium in gonorrhea is responsible for gonorrhea infection. These bacteria thrive in a warm, moist environment. As a result, the infection can affect any of the mucous membranes, including those in the genital area, mouth, throat, eyes, and rectum. A person transmits the infection to another individual through sexual contact that involves the penis, vagina, anus, or mouth. Males do not need to ejaculate to pass on or get gonorrhea. A pregnant woman can also pass the infection on to the baby during delivery. All sexually active individuals are at risk of having a gonorrhea infection, but in the United States, it is most common among adolescents and young adults. Complications. Gonorrhea can lead to a number of severe complications. For this reason, it is important to seek early diagnosis and treatment if an infection may be present. In females, gonorrhea can lead to pelvic inflammatory disease, a condition that can cause abscesses and other complications, chronic pelvic pain, infertility, ectopic pregnancy in which the embryo attaches outside of the uterus. Further complications of a gonorrhea infection can occur during pregnancy and delivery. It is possible to pass the infection to the child, which can result in joint infection, loss of vision, or bacteremia, a life-threatening blood infection. There is also a higher risk of preterm labor or stillbirth if a pregnant woman leaves gonorrhea untreated. In males, a gonorrhea infection can lead to epididymitis. Males with epididymitis may experience fertility issues. In both males and females, untreated gonorrhea can lead to disseminated gonococcal infection, a life-threatening condition that can cause fever, arthritis, inflammation and swelling around the tendons, dermatitis. People who have a gonorrhea infection also have a higher risk of contracting or transmitting HIV. One reason for this is that an infection can lead to open sores, and when there is a break in the skin, it is easier for another type of bacteria or a virus to enter the body. Prevention. Ways of preventing a gonorrhea infection include avoiding sexual activity if there is a possibility of infection, using condoms during vaginal or anal intercourse, using condoms or dental dams for oral intercourse, having sexual activity only with a mutually monogamous, unaffected partner.